Michael Horton here again for theCandidaZone.com. Welcome back. This is another video about why and how I treat my cancer and my candida at the same time with alternative natural therapies. I want to show you my mammogram and my biopsy report. I had this mammogram 2 years before my first video exam. Notice the date, it was November 2012. At that time, the tumor measured just 1.9 by 1.8 by 0.9 centimeters. It's suspicious for neoplasm, which is cancer. A biopsy is needed. This is the biopsy report a few weeks later in December of 2012. Notice the final diagnosis. Atypical papillary proliferation cannot rule out in situ papillary carcinoma. Conservative but complete surgical excision is recommended. Well, in the previous video, you already noticed I've declined surgery, even though there are 4 additional doctors who also recommended immediate surgery. But then 2 years later, it was very clear to me that I had to start my own bicarbonate therapy immediately for 2 reasons. And the first was that I had recently noticed some symptoms of metastases to the lymphatics in my left arm area and also to my diaphragm area. And the second reason, although it had just been a few weeks since I had met with a 4th doctor, I still hadn't found one who was willing to treat my cancer with bicarbonate as I wanted, by inserting a catheter as close to my tumor as possible and then irrigate the tumor with a bicarbonate solution. They each recommended a mastectomy instead. And I understood why they declined. By itself, bicarbonate irrigation of the tumor, it's not an approved medical treatment for breast cancer. So I filmed the first video exam, and then I immediately started my own full-time bicarbonate therapy. But nevertheless, you've got to wonder, why would I wait 2 years after the mammogram and the biopsy report before starting some kind of a cancer therapy, even if it was just bicarbonate? Why would I wait 2 years? Well, actually, I didn't wait. I started bicarbonate and I restarted bicarbonate several times during 2013 and 2014. I would use bicarbonate for just a few weeks, and I noticed it consistently starts killing the tumor pain, and often within just a few hours. And it also seemed to slow down the growth of the primary tumor. Let me give you an example of how bicarbonate was working for me. Just a few weeks before meeting the 3rd doctor, I had once again started bicarbonate because of the fresh symptoms I noticed of metastases, swollen lymph nodes in my left arm area. Well, as doctor number 3 was examining and manipulating one of the swollen lymph nodes, he asked if the lymph node was painful to the touch. Normally, it would be very painful. But not now. It wasn't, because I had restarted bicarbonate a few days before coming to his office. I asked if he would be willing to treat my cancer with bicarbonate, and he said no, that the only thing that he would consider was a surgical removal of the breast tumor, all swollen lymph nodes that he could find in the area, and any other swollen or suspicious tumors that he could find in the area. And then he would start massive chemotherapy. Well, I declined his recommendation. Instead, I continued to use bicarbonate in my drinking water. Then about 10 days later, I met doctor number 4, who examined all of my symptoms, and then he offered his opinion that this probably isn't cancer. It was probably gynecomastia. He believed that my hormones were likely out of balance and caused the tumor growth. Well, by that time, I had already been using bicarbonate daily for about 2 weeks, and not only had the pain stopped, but the swollen lymph nodes were shrinking and disappearing. So whether we call it cancer or gynecomastia, I asked if he would treat it with bicarbonate. He declined. He said bicarbonate would likely have no effect on him because he was convinced the hormones were the likely problem. And like all the other doctors, he recommended a mastectomy and then hormone therapy. So throughout all of this experience, I'm not nearly as rushed to start my cancer battle with some mastectomy or a chemo or a hormone therapy or some radiation. Why am I not rushed? Because I'm able to manage the pain with bicarbonate. As bicarbonate decreases my cancer pain, I calm down quite a bit, and I start doing a lot of homework, looking at my alternatives. Do I have any options? And so by the time of my first video exam in 2014, I knew already from 2 years of personal experience that I was already using something very good for my cancer: bicarbonate. I think you need to know that. Thanks for watching.